Friends, I am Dr. Hemant Pathak, Urologist, Lilavati Hospital. Today I am going to speak on prostate cancer. Prostate is a male gland at the base of the bladder, and the enlargement of this can be age related, that is benign in nature, or in 5% of adult male population it can end up having cancer. The incidence of cancer increases as the age increases. Secondly, there will be some patients who have a family history of prostate cancer, and hence they will be at more risk of developing prostate cancer. Thirdly, those who have mutations like BRCA mutations will also be at higher risk. So, now coming to prostate screening, one is which patient should undergo prostate screening: those who have family history, those who have BRCA mutations, and thirdly, after the age of 60-65, one can undergo screening for prostate cancer. Screening involves blood test, that is PSA test, called as prostate specific antigen. So, if this test is elevated, it gives a warning signal to the treating doctor that yes, the patient may be harboring a malignancy, and hence he subjects the patient for further evaluation in the form of MRI and prostate biopsy to confirm the diagnosis. Now, once the diagnosis is confirmed, it depends, the treatment would depend on what the stage of the disease is. Normally, prostate cancer doesn't have symptoms of its own. If certain individual presents with symptoms because of prostate cancer, normally the prostate cancer is already in advanced stage. So, early detection is important in the form of prostate screening and evaluation and treatment. So, when the diagnosis is confirmed at a very early stage, that is when the disease is localized to the prostate gland, then the treatment is aimed at being a curative treatment. The curative treatment would be surgery in the form of radical prostatectomy, which is either done laparoscopically or robotic assisted laparoscopic prostatectomy, and that is a completely curative treatment. Now, if that patient is elderly and is not suitable for surgical modalities, then the second best would be radiation therapy, which is also curative. Now, if the disease is at a slightly advanced stage, means what? If the disease has spread to the adjacent organs or to the bones, then the treatment modality would change, and hence the treatment modality basically is a hormonal treatment, and in advanced disease there would be a chemotherapy treatment also. And in cases where there is a bony spread, in those cases radiation in the form of either localized radiation or what you nowadays we call it as a PSMA theragnostics in the form of lutein or actinium is given. Now, if the disease is diagnosed at a very early stage, it is completely curative and patient can have a normal lifespan depending upon the grade of differentiation, meaning what? That whether it is a good cancer or a bad cancer, which is on biopsy. Now, coming to is this disease preventable? So, preventable, yes. Prevention is basically depends on the lifestyle management. That is, if you have a good exercise program, if you end up having a good diet, avoiding smoking and excess alcohol, all this have shown that the incidence of prostate cancer can definitely be reduced in a given population. Secondly is, can a patient avoid any treatment? That is what we call it as surveillance. Surveillance, yes. Elderly patients with low form of disease, that is diagnosed, cancer is diagnosed, but it is in the low grade. These patients are followed up with blood test and imaging modalities and can be kept under surveillance and put on treatment only when required. So, just to summarize, prostate cancer is a treatable disease with giving a good lifespan and good lifestyle when treated properly, and hence one should screen properly at appropriate age and get treated on time. Thank you.